Mtazamaji, moja kwa moja basi nataka nikuarifu kwamba mamlaka ya takwimu nchini kwa ushirikiano na Wizara ya Afya inazindua ripoti kuhusu idadi ya watu na afya ya mwaka 2022 KNBS. Aidha, ripoti hiyo ni ya 7 kuzinduliwa na inaangazia masuala yanayofungamana na uchumi, jamii, afya bora kwa wote, utumizi wa mbinu za mpango na wa uzazi na vile lishe. Hebu tuelekee moja kwa moja basi kwenye matukio na hafla ambayo inaendelea kwa sasa hivi ambayo ni ya kirasmi, na tunakuletea matangazo ya moja kwa moja kutoka jumba la kimataifa la KICC.
The only thing is that we are not appreciating them. Thank you. Thank you. And to guide the whole process, we had, other than the KNBS board, we had the steering committee coming from the various public institutions and the development partners. Kindly just rise up to be seen wherever you are. Yes. Thank you. So the two groups have actually made us be here today. And now back to the presentation. Move to the next slide. And move. Yeah, so the primary objective of this study of DHS 2022 was to provide the up-to-date estimates of demographic and health indicators to guide planning, implementation, monitoring and evaluation of population and health-related programs at the national and county level. So we have a number of reports that are speaking to the counties. We are not able to have all of them because, of course, the sample size that would be required to get indicators that are hard to achieve using small sample size. So the tools, we had 5 different tools. 4 of them relate to the survey directly, as given on the screen. The next one. Now, we normally get a lot of comfort from, if you are doing a survey, you need to get comfort from the size of that survey and the distribution of the elements that are giving you the data. And so we had 42,022 households that participated in this. Actually, we selected 42,300, but then we managed to identify 42,022 households. Then those that were occupied is given there. So the percentage that that were able to respond was 98. Then for women it was 95, and for men, as usual, it is low. Men are never found, are not easily found in their households. It was 87. Now then, my presentation is only covering 3 parts: the housing characteristics. Just go to the next one. The housing characteristics, and then the household population. Then the last one is on water, sanitation, and hygiene. Now, this forms the basis upon which the results have been, the data has been analyzed and results given. Now, we had something on the electricity penetration in the country, and we noted that Kenya has 51% of the population having electricity. In the census of 2019, it was 50.4. So in the survey, we have established 51%. And of course, it is higher in the urban and relatively low in the rural. Now, we also looked at the element of the usage of the electricity. Those are using it for cooking, then heating and lighting. And we realized that in the country, 21% is using electricity for cooking, heating, and lighting. But for the lighting, for the urban, it is high at 53% and relatively low at for the rural at 5%. Now, the next one is on the households with information communication technology, and that is by residence. So we are looking at the urban and rural. So in Kenya, we take note that those who are using mobile phones are actually the majority. So you walk into a Kenyan household, one of the things that you'll easily get is a mobile phone, and you can see the percentages. At the national level is 94. In the urban it is 97, and in the rural it is 91. Now the computers, this is the most the most rare one, where we only have 11% of the population of the households is having computers, and majority of them at 22 is in at 21 is in the urban. So that is, and of course, that is these are some of the channels that would also be helping us when it comes to getting information. Now, in terms of wealth index, we have what we did was to look at the key household goods and then their numbers, so that we are able to calculate or come up with information on. Let me take a short break as our CS is coming in. Welcome, Madam. Yeah. So the CS, Minister of Health, has just walked in. Madam Nakumicha Wafula, thank you for coming in and attending to this important function. Actually, most of the indicators in this survey are used by the Ministry of Health. And so it is such an important document to the ministry, and you can see the demonstration on that. So then I would continue. So we looked at a number of household goods, and they were assigned scores, and also in terms of numbers and the kind of goods that we have. And out of that, we created the wealth index. And within the wealth index, it was subdivided into 5 to give us the component of various levels of wealth quintile, which is given on the screen there. So we have in the rural, in the urban, the majority of those who are in the highest wealth quintile are 53%, while in the rural, those who are just falling in that category, the highest category, are only 3%. But we also take note of this component in the rural, where the lowest, second, and middle, we have 29, 28, and 26% respectively, and we can see that this house in the rural, majority of them would fall in the lower wealth quintile. Now, the other thing that has been revealed when we look at the wealth quintile in terms of counties, then Turkana County happens to have the highest proportion of the household that are in the poorest quintile. And Nairobi, of course, at 71, is in the highest category of the wealthiest. But notice also need to be taken that much as we are saying they are rich, they might not be really, really rich, but they belong to the higher socioeconomic status beyond the other 80%. So for this one, if you are to draw the graph, you'll be talking of the cumulative graph and subdividing into 4, so that you are clearly able to see what you are talking about in terms of population and where they belong to. Then next is to look at the household population, which again we have just a few indicators to demonstrate what is contained in the big reports. And in terms of population household, we have the 40% of Kenyans of the population being under 15 years of age. That means we have a large group of Kenyans to really plan for, because at that age, and below, we require a lot of resources to support the youth. Then in terms of headship of households, 34% of households are headed by women. In the last DHS of 2014, it was 32, so it has gone up over the period. Then households, the household average, that is the number of people in a household, has been established to be 3.7%. There is no human being who is half or quarter or the like, but that is the average. So it is between 3 and 4 persons being common in household. Now in 2014, we established the number to be 3.9. So that means something is happening to our population. We are actually, we are slowing down in terms of growth. So I'm sure Dr. Sheikh will elaborate on that, because his family planning approach is actually working. It is demonstrated, well demonstrated there. Now, health insurance coverage. This is an issue which is a big concern to the country, and the Kenya Kwanza government is taking it up very, very seriously. We established that, or the survey established that only 26% of the household population had insurance cover. Now, that 26% is now broken down in the next graph on the right. And on that one, what it says is that majority of that group of 26 are actually have taken the National Health Insurance Fund, that is NHIF cover, and that is at 24%. Then we have the private and commercial, which we get from other insurance companies, is 4%. Then we have community-based. Community-based kind of insurance is that people are coming together, the community is coming together to contribute money and get some form of insurance. Or they contribute, but they keep their resources so that when any member falls unwell, then they are able to take care of the medical cover. And so that is, if just go back to that slide. If you try to add them, they'll not come to 26. It is more than 26 because there are multiple cases. There are those guys who have taken NHIF and they are also insured through other means. So that multiplicity means that you are not going to get just the 26%. So the next one is the birth registration. And for the birth registration, we are taking note that we have just about 34% whose births are registered, and then we have 42 where it is registered but the birth certificate is not there. Then we have those cases that have not been registered. So in all, we are talking of 76% whose births are actually registered, and we have 24 without their births being notified and registered. Now, in this case, when you look at the slide, you might think that there's a mistake. It's just a coincidence, mathematical coincidence. We have 24 up there, 42 next, and then 33. There's no mistake in it. It is as correct as presented there. Next, now, as I said, there are a number of slides that are covering the county situation, and so we have presented a few of them. For the counties, we are presenting them using the maps for clarity of seeing what is happening. So that birth registration that we looked at the county level, of course, it is still at 76% at the national level, but at the county level, we see the disparities where the Nyeri County has 96% coverage. That is the highest. And the lowest happens to be Wajir at 30%. So it varies across the board. But our average is 76. Next is the net school attendance ratio. This one is looking at those people who are meant to be in school, those who are meant to be in primary school at the right age, and those who are meant to be in secondary school at the right age. And so it is only looking at the total numbers of those ages against what numbers are really in school. And so we realize that for primary, the net attendance ratio is 86%, while in the urban it is a little bit high at 89%, and of course lower in the rural at 85%. Now for the secondary, it is much lower. Remember, not all are in primary, and not all are joining Form 1. So we have Form 1 up to Form 4. So we have 49% for the secondary case. And in the 2019 census, we actually established 42.4%. So there has been some improvement over time. Next. Now I'm looking at the water, sanitation, and hygiene. And to take us there is the question that was asked about drinking water. Not the general use of water, but drinking water, and it is done by residents. And you are able to see the ladder that is given there. In that ladder, it is saying that about 2/3 of Kenyans, that is 68%, has at least basic drinking water. Now, basic drinking water, when we talk of at least basic drinking water, what it means is that we are looking at water from improved source, and it is either provided within the premises, or if you are to go for it, you'll take not more than 30 minutes to walk there, fetch the water, and come back. Now, that is the at least basic service. Then we have the limited service, where you will be going to get the water, but it takes you more than 30 minutes to get there. More than 30 minutes to walk there, fetch water, and come back. So then we have the unimproved sources, which are a bit now not safe at all. Same to the surface water, which would include the river and the like. So we take note that at the national level, we have 68% for that, urban 91%. So the usage of safe water is much higher in the urban, and only at 56% in the rural. We go to the next slide, which is still on the same, but now breaking it down by counties, and you can see how varied it is. Maintaining the figure at 68% for the national, we realize that Kitui happens to be having a very low percentage of the population who are able to get at least basic service. This is followed by Samburu at 29%, West Pokot at 38%. But then there are those counties that are doing very well. We are able to see that we have Nairobi, of course, being the highest at 99%, followed by Kiambu 94. We have Nyeri 91, and we have Nyandarua at 90. So basically, the central Kenya region, is actually enjoying safer drinking water. Then we move to now of the water that we are talking about. How about its availability? Is it sufficient enough for the population? And we realize that at the national level, it is 65%. But we have Vihiga and Kisii that are feeling that their drinking water is sufficient at 90%. But Garissa has the lowest at 23%. Then we move to the element of sanitation service, and we are looking at the ladder. I forgot to tell you one thing. As we are looking at these slides, the far right-hand side, if it is an indicator that is also required to be reported for the SDG, we have indicated on the slide that it is which particular indicator. So we are talking of two indicators for this case of the sanitation, and so you keep on checking on the slides. We have given those those details to help us understand that we are reporting quite a number. We are able to get quite a number of indicators within this survey to report for the SDGs. Of course, these slides will also be on our website for you to access. So on this, at the national level, we have 41% of the population having access to to at least basic sanitation services. And here, what we mean by at least basic sanitation service is the use of improved facilities which are not shared. So if you talk of at least basic, then we are talking of an improved facility whose services are not shared by other households. It is only used by one household. Now, limited service is a situation where it is improved facility, but it is shared. It could be shared by by two households or even more. And of course, the other one is not a good one, where it is we have an improved one, then we have the open defecation, and you can see in the urban we have cases that are still using the open at 1%. We have rural 10%. No, is that an open? No. It is 10% is using the open defecation, and that's such a serious concern in the world of today. We move to the next one. I'll jump that one. It is meant for the authorities on what they need to do based on the findings that we have. Just move to the next one. Then it's about the availability of hand washing facility by county. So we at the national level it is 51%. Of course, if it were during the COVID time, if this survey was to be conducted around the COVID time, definitely the percentage was much higher. But I think people have relaxed to a great extent. We only have 51%. Now, so Nairobi has the best, but then Tana River and Wajir are only doing it at 7% each. Then we go to the next slide, which is on menstrual hygiene by residents. Again, this was captured for those for the females who are between age 15 to 49, and at the national level, we note that almost all women have access to clean and private place to change and wash during menstruation time, which is a good thing. But we do not know if you are to bring on board the younger persons. Maybe the situation could be, the percentage could be a bit different. But as it is today, it is better, though you'd want to have it at 100%. Now, all that I've been talking about on that are actually covered, are given in that slide. So maybe if you feel you needed to take a photo of that, you could do that. Otherwise, I don't need to repeat what is there. Now, I'm now looking at the response characteristics, and we are starting with, remember, these characteristics are the ones that are forming basis for analysis. So then, on the education in terms of literacy, we note that 91% of women in Kenya are literate, and 94% of males are literate. So when we talk of literacy, we are looking at women and men who attended school higher than secondary level, and the same women and men who attended, whose school attendance was less than that, but are able to read a whole sentence or part of a sentence. Now, we are able to at least get something from here. It is long since we did the literacy survey in the country. The last one was done in 96, and the gentleman who was actually dealing with it is here, Fred Otieno. I'm happy that you are here, boss. He's the guy who also introduced me to the DHS, and I've kept the fire burning, sir. Thank you. So literacy survey, we need to do it, but as at now, we can be comfortable that Kenya, the Kenyan population is highly literate at 91% for women and 94% for female. Now, the next one is on the mass media exposure. And so here, we are looking at it that access to mass media facilitates information and intellectual growth. And so the percentages that are able to access various forms of getting information are actually given where we have the newspaper, television, radio, and all the three. Then those who are also not able to get any of the three. So we note that the most common one is radio, where for women it is at 62% and men 71%. Newspaper is less accessed at only 8% by women and 17% by men. And of course, in each category, you realize that men are actually having a better chance of accessing these channels. And for the non, you realize that again now women are forming the majority, which is not a very good thing for us. But that is the situation we are in. It is that low for getting those who are accessing it in all the three forms. Now, then the internet usage, in all, men and women use internet, but what we are presenting here is for the last 12 months, and the last part of it, which is 44% and 56%. Again, men use it more than females. So the question was about usage of internet in the last 12 months before the survey. So that is what it gives. Then the next one is employment. And as I said, these are the ones that will be able to help in analyzing the results. So for the health, for the employment status, which is given by age and by sex, we note that 60% of women and 81% of men were employed in the last 12 months before the survey. And employment is higher with both groups past 25 years of age. So you can see it is actually growing higher as you go along. Now, when we talk of employment here, there was a question that was dealing with 7 days. Have you worked for the last 7 days before the survey? And then the other question was about, have you worked, did you work in the last 12 days before, the last 12 months before the survey? And so in that last 12 months, it contains those who are working at one point and maybe they are no longer working, they don't have a job. Those who are working, but for some reason at the time of the survey, they are on leave or sick or something. All of them are included there. That's why they are very high. It does not mean that the Kenyan population has jobs at that rate. Then I'm concluding by an indicator on tobacco, and you can see it is also an SDG indicator 3.8.1. Now here we are dealing with the percentage of women and men aged 15 to 49 who are currently using any type of tobacco. Here we are able to see that men use tobacco more. And by the way, I'm talking of usage, not smoking. Let us get the difference. It will be explained ahead somewhere. Now, we are talking of use. You know, there is the smoking, and there is also putting the tobacco in the mouth. That is usage. That is use, not smoking. But it results into the same thing. So in the survey, we talked of usage, and you can see the figures are rising by age. And that is for both men and women. But for men, it is they are the most notorious one on that, as you can see. So we take note that it is a bit rare in Kenya because it is only 1% of women who are smoking, and 12% of men who are, sorry, not smoking, who are using it, and only 12% of men who are also using tobacco. Now, recently, and very, very recently, I think within the last 1 month, a report was released by NACADA, which was it was 2022 National Survey on Status of Drugs and Substance Use. And in it, it established that for persons who are 15 to 65 years, 17 of males were using tobacco, and 2% of female were using tobacco. We have seen the difference. There's a slight difference between the two, but they are actually very, very close. Now, then, when you get to this, this one is also broken by the same thing, but broken down by counties, and we see that in the country it is 10%, 1% for women. But now look at Turkana. Turkana has 33%, and Samburu has 16%, and Marsabit has 10%. That is for women. So the usage is high in Turkana at 33%, while the national average is only 1%. You can see that difference. So it is very common in Turkana. Then the next one, which is for the men, it is 13%. Now, something is not very right. The other one is, the national is 12, and here is 13. Something is not very right. One of them is not correct. We'll be able to have the corrected version as we upload it on our website. Now I cannot tell whether it is 12 or 13, but we'll confirm. Now, the breakdown shows that the northern region is actually highest when it comes to use of tobacco. We have Marsabit 32%, Turkana 27%, Samburu 36%. So we have some areas that are look at the red part. Actually, those are the areas with the highest usage of tobacco. But the Mandera, Wajir, Garissa, Wajir, Garissa, yes, no, Mandera, Wajir, they are actually using it much less. That is northeastern, which is also a good thing. So then I go to the alcohol one, the alcohol consumption, which basically is my last one. This is the last slide I'll be speaking to. 26% of men use alcohol. 5% of women also use alcohol. Highest usage is in urban, as you can see in the middle graph, bar graph. And so if we compare this one with the National Survey on Status of Drugs and Substance Abuse, we noted that for female it was 5%, as also given here, and then for males it was 20%. Of course, those differences, I've mentioned that the national one, the NACADA one, was talking of 15 to 65. And this one is talking of 15 to 49. So those differences in age could also be contributing to the difference that we are seeing. But what I'm trying to confirm to you, that the two are speaking to the same thing. The last slide is just giving the summary of what I had for what I've been talking about. So thank you so much. That is the end of my presentation. My next colleague is actually coming on board. Dr. Sheikh is coming to take us through. In the Bureau, we provide the statistics. After that, we hand it over to those who will now deal with the policy matters. And the gentleman coming after me is dealing with policy on issues of what we have given. And actually, all the speakers who are coming behind me are speaking to the same, dealing with the now matters beyond the release. What will happen? Of course, today they are giving the report, but in the evening, we'll now start talking about how do we make good use of what we have gotten from the survey. Thank you and welcome, Daktari.